I welcome you on my channel Step 1 Insights. Let's start. A 56-year-old woman comes to the physician because of a 2-year history of recurrent urinary tract infections accompanied by left flank pain. Physical examination shows no abnormalities. Renal ultrasonography shows left-sided hydronephrosis. A T2-weighted coronal MRI of the abdomen is shown. The arrow indicates the hydronephrosis. The left renal collecting system is most likely obstructed at which of the following anatomic locations in this patient? Based on the provided clinical scenario, the woman has left-sided hydronephrosis, which is a condition characterized by the distension and dilation of the renal pelvis and calyces, usually due to obstruction of the free flow of urine from the kidney. Here's a brief explanation of each option in relation to the scenario. Bladder neck. An obstruction here would typically present with symptoms related to bladder outlet obstruction and would often affect both kidneys. Mid-ureter. This would usually be due to a localized obstruction such as a stone. Given the history of recurrent UTIs, a stone could be a possibility. However, the location of the pain and the unilateral nature of the hydronephrosis suggest a higher obstruction. Renal calyx. Obstruction in the renal calyces would not usually cause significant hydronephrosis unless it was a large obstruction or affected the infundibulum, the area where the calyces join the renal pelvis. Ureteropelvic junction, UPJ. Obstruction at this location is a common cause of unilateral hydronephrosis and could result from congenital abnormalities, acquired conditions like stones or strictures, which could be suggested by chronic UTIs and flank pain. Ureterovesical junction. Obstruction here can also cause unilateral hydronephrosis and might be associated with ureteral stones or other issues near the bladder. Given the information that it's a case of left-sided hydronephrosis, the most likely sites for obstruction based on the typical presentations would be either the ureteropelvic junction, UPJ, or the ureterovesical junction. The UPJ is a common site for congenital or acquired obstruction and could be consistent with the presentation of unilateral flank pain and recurrent UTIs. Thank you for watching this video. Subscribe my channel, click like, and never give up.